I primarily do a lot of preventive medicine and women's health care, so do a lot of counseling on what sort of tests you should be having at your age and with your family history, and trying to keep people healthy, so focus a lot on the preventative exams.
The difference between an MD and a DO isn't very dramatic. Where they are really set apart is that the DOs, in addition to learning all of the traditional medications and referrals and surgical practices and procedures, we're also given a lot of hands-on training in terms of manipulative therapy, bones and skeletons and muscles and nerves, and how to balance the body and approach it from more of a holistic viewpoint. I approach treating patients very much like I would treat, people in my family. When they come and ask me, hey, will you look at this? Or will you say, tell me what this is, or can you help me with that? I try to get to know as much as I can about their background and where they've been in terms of previous physicians, as well as understanding why they're there today, like what made it change to alert it to their attention or to my attention.
After all these years of practicing, I have some families I see 3 generations, even 4 generations, and it is great. It makes a huge difference in how you view the patient, not necessarily always physically, but even socially. Physically, from a medical history perspective, that's important to know what's going on and what you want to watch for. But then also socially, knowing the dynamics of what's going on in their lives, different stressors and things like that, always kind of helps you treat the patient more holistically. We are well located with a lot of OhioHealth facilities around us. We're next to the physical therapy office, and the urgent care is on the first floor. So for patients that need to be seen after hours, a lot of times they can be seen there. We all share electronic medical records, so we can see what's been done at different OhioHealth facilities. And then we're right across the street from Dublin Methodist, so that's very convenient for patients as well.
I think that this office is different from other offices because we have a very close-knit staff. We have very comfortable atmosphere and collegiality around here that makes people who come to the office really feel like they're at home.
We really function as a family here. The staff and the physicians all get along. It's a great environment. Patients feel that when they come in the door. Many of my patients have commented that, we don't always feel that when we go into other physicians' offices, but we know when we come here, it's really like, coming to a family environment.